Have you ever found yourself feeling down or withdrawn and wondered if it was just another part of getting older? So many people in their 70s and beyond wrestle with persistent sadness or a lack of enthusiasm. Yet they brush it aside as something they simply have to live with. Depression can creep up in subtle ways, making everyday activities feel more tiring and even dulling the joy we once found in hobbies or social gatherings. The real challenge is that many seniors believe that admitting to feeling low is a sign of weakness, or that there's little that can be done safely at this stage in life. But here's the truth. There are options that can help ease depression, and among them are a class of medications known as Selective Serotonin Reuptake Inhibitors, or SSRIs. While no medication is completely without risk, healthcare professionals often view SSRIs as a safer choice for people over 70 when used under proper guidance. This matters more than you might think. Depression isn't just about mood. It can influence physical health too. When we feel low, we may move around less, skip nutritious meals, or avoid activities that once kept our minds sharp. In turn, that can affect our energy levels, sleep quality, and even relationships. By addressing depression with the right support, many older adults discover renewed vitality and greater emotional stability, enabling them to stay engaged in activities that maintain physical health and independence. Over the next few moments, we'll explore 4 key insights about why SSRIs, under a doctor's supervision, may help ease depression safely for those in their 70s and beyond. You'll learn how these medications work in the body and brain, what misconceptions might keep you from considering them, and how to address concerns about possible side effects or interactions with other treatments. Above all, we'll focus on practical, actionable steps, like regular check-ins with your healthcare provider, sensible lifestyle additions, and self-advocacy that empower you to take charge of your emotional well-being without compromising your overall health. I've spent many years focusing on senior health challenges, specifically looking at how mood and emotional well-being intersect with independence and physical capabilities. I've seen the difference it makes when older adults have accurate, reassuring information about their options. This isn't about pushing a particular medication or dismissing genuine concerns. It's about shining light on a path that might be overlooked, one that, if approached thoughtfully and under medical supervision, can help you or someone you love rediscover a sense of calm, balance, and enjoyment in the everyday. So if you're feeling uncertain or worried about starting any new medication, especially one for depression, stick with me. By the end of this discussion, you'll feel better informed about why SSRIs are increasingly recommended for older adults and how they fit into a broader approach to managing mood. You'll also see why it's essential to talk openly with your doctor and how small lifestyle shifts, like gentle physical activities or mindful nutrition, can amplify the benefits of treatment. Feel free to take notes or even pause the video to reflect on how this information relates to your life. And if you know others who are quietly wrestling with low mood, consider sharing what you learn. It could be a turning point not just for you, but for the people around you who might also need a little extra hope and encouragement. Now let's walk through each of these 4 points one at a time and clear up some of the most common myths standing between seniors and the relief they deserve. First, let's consider how SSRIs can counter a harmful assumption many of us hold about depression after 70. Point 1. Challenging the myth that depression is inevitable in older age. A lot of seniors harbor the idea that feeling down, isolated, or disinterested is a natural part of aging, something you just have to live with. You might have heard statements like, "Well, I'm 75. Of course I feel blue sometimes." This assumption can stop older adults from seeking any sort of help or even discussing these feelings with a doctor. But it's important to understand that while mood changes may be common, they're not an unchangeable fate. One misconception is that talking about depression or seeking help for it automatically means getting trapped on medication that's risky or causes you to lose control. Some seniors worry that antidepressants are too powerful or that they'll be saddled with unpleasant side effects. They might recall older classes of antidepressants that indeed carried higher risks for blood pressure changes, sedation, or other uncomfortable effects. But SSRIs represent a newer generation of treatment, often designed to minimize many of those earlier pitfalls. Margaret, who is 78, offers a relatable story. After her spouse passed away, she found it hard to engage in her usual morning walks and gave up her favorite bridge group. Over time, her sadness deepened. When her daughter suggested seeing a doctor about depression, Margaret initially scoffed. "I'm old. This is normal." However, during a routine checkup, her physician mentioned SSRIs as an option. Margaret was initially hesitant, having read decades ago that antidepressants caused addiction-like dependency. With her doctor's reassurance, she decided to at least try, while also joining a local bereavement support group. Within a few weeks, Margaret noticed a subtle lift in her mood and a greater willingness to resume social activities. She still misses her spouse, of course, but she's no longer overwhelmed by hopelessness each morning. The evidence behind SSRIs is that they help balance chemicals in the brain, primarily serotonin, which plays a key role in mood regulation. While not a cure-all, they can provide a steadier emotional foundation. Experts in geriatric medicine often highlight that SSRIs are particularly well-suited for older adults because they generally pose lower risks of severe side effects compared to some earlier antidepressants. What can you do if you find yourself in Margaret's situation? First, talk openly with a healthcare professional who understands senior-specific needs. Mention your symptoms, whether it's a loss of interest in once pleasurable activities, changes in appetite, or feeling persistently sad. Ask them about the differences between older antidepressant options and newer SSRIs. Discuss how these medications might fit into your life, considering any other prescriptions you're taking. The benefits aren't only emotional. By reducing the intensity of depression, you may find it easier to engage in gentle physical exercise, such as a short daily walk that helps with mobility and independence. You might also feel more inclined to reconnect with friends or try a new hobby. An improved mood often means better sleep too, which is crucial for memory, concentration, and immune function. Ultimately, feeling less weighed down by sadness can restore a sense of hope and purpose. Before we move on, remember, addressing depression doesn't mean you're weak or too old to benefit. Many seniors have rediscovered a meaningful sense of normalcy by combining SSRIs with supportive measures like therapy, social connections, or structured routine changes. It's not about forcing positivity, but rather giving your mind and body the support they need to function at their best. If you've ever thought depression was just part of aging, let Margaret's experience remind you that it truly doesn't have to be. As we continue, I encourage you to reflect. Have you or someone you know dismissed feeling low as simply getting older? Jot down any beliefs you've held about mental health in later life and see if they still ring true. Sometimes our deepest assumptions deserve a closer look. Point 2. Overcoming the fear of medication interactions. Another reason many older adults are reluctant to consider SSRIs is the fear of too many pills. After all, a lot of people in their 70s are already managing multiple prescriptions for blood pressure, arthritis, or heart health. You might worry that adding one more medication increases the risk of side effects or dangerous drug interactions. This concern is valid. Polypharmacy is real, and older adults are more susceptible to complications. However, it's also possible to manage these risks and gain the emotional benefits SSRIs can provide. The misconception here is that adding an antidepressant automatically triggers a cascade of negative interactions, or that it signals a failure on your part to stay healthy in other ways. Many seniors feel embarrassed about needing psychiatric medication, fearing judgment from peers or family members. Others recall a friend who had a bad experience taking various pills at once, leading them to swear off any new prescription. Consider Arthur, age 80, who was taking medications for high blood pressure and type 2 diabetes. He had always prided himself on handling life's challenges with quiet determination. Over time, however, he started feeling consistently tired and unmotivated. His wife noticed he was withdrawing from their social circle and spending more time napping, but not because he was physically exhausted. He just felt down. A neighbor suggested Arthur see his doctor about possible depression. "No way," Arthur responded initially. "I already rattle when I walk." During his next checkup, he hesitantly mentioned his low mood. His doctor explained that some SSRIs have a lower risk of interacting with common heart and diabetes medications, and that careful monitoring during the first few weeks could minimize potential issues. They agreed to a trial with monthly appointments to evaluate his mood, vitals, and any emerging side effects. To Arthur's surprise, not only did his depression symptoms ease, but his healthcare provider also used these monthly visits as an opportunity to refine his entire medication regimen. By carefully adjusting dosages and timings, Arthur found himself feeling not only emotionally lighter, but physically steadier. He also learned about possible side effects to watch for, such as dizziness or changes in blood sugar levels, and knew to contact his doctor if they appeared. So, is it risky to add an SSRI into an existing mix of medications? It can be, if not properly supervised, but when done under a knowledgeable doctor's care, the risk can be greatly reduced. Many providers will start at the lowest effective dose and schedule follow-up visits or phone calls to track how you're doing. They'll also confirm whether any new medication interacts with what you're already taking, possibly making changes where necessary. What steps can you take? First, maintain an updated list of all medications and supplements you use and bring it to every medical appointment. Don't be shy about asking your pharmacist questions. You can also request periodic medication reviews with your healthcare team to ensure everything is up to date. If an SSRI is deemed appropriate for you, remember that many seniors do well on relatively low doses, with gradual increases only if needed. This kind of vigilance keeps you safe and in control. And the payoff? Improved mood can help keep you motivated to stick to your other health regimens, from meal planning to gentle exercise routines. Emotionally, it's empowering to know you haven't let the fear of just one more pill stand in the way of feeling better. Think about any apprehensions you've had regarding the number of medications you take. If you're worried about interactions, see it as an invitation to have a thorough discussion with your healthcare provider. It's entirely possible to manage your medications in a balanced way that supports both your mental and physical well-being. Before we move on to the next point, I invite you to pause and consider. What would change in your day-to-day life if you had the energy and clarity that often come with treating depression effectively? Sometimes acknowledging the positive possibilities can motivate us to seek the support we deserve. Point 3. Addressing side effects without losing hope. Whenever the topic of antidepressants comes up, side effects loom large in many seniors' minds. It's entirely normal to worry about potential issues like nausea, dizziness, or sexual dysfunction. Perhaps you've had friends who tried SSRIs and complained they felt foggy or too tired to function. The challenge is that fear of side effects can overshadow the real relief that SSRIs can provide. The goal, then, is not to ignore possible downsides, but to approach them with knowledge and strategies for prevention and management. A common misconception is that side effects are always severe and permanent. In reality, many are temporary or can be managed with dosage adjustments. Some seniors also believe that if side effects appear, it means the medication isn't right for them, and they have to stop immediately. While abrupt cessation can sometimes be warranted, it's often more about finding the right type of SSRI or the correct dose. Take Gloria, age 74. She had been dealing with persistent sadness and anxiety for months. Having heard scary stories about antidepressants, Gloria tried to tough it out, figuring she'd eventually bounce back. When a close friend shared how SSRIs had helped her regain a sense of balance, Gloria decided to see her doctor. She started on a small dose of an SSRI known for a mild side effect profile. The first week, Gloria experienced some nausea and a bit of trouble sleeping, which made her wonder if she was making a mistake. But her doctor encouraged her to keep monitoring how she felt, while also practicing good sleep hygiene, like avoiding caffeine late in the day and creating a calm nighttime routine. Within 2 weeks, the nausea subsided and her sleep actually improved, particularly as her anxiety lessened. What's the science behind this process? When you begin taking SSRIs, your brain's chemistry needs time to adjust to the new balance of serotonin. During that adjustment period, side effects are more common. For many people, they taper off as the body adapts. If they persist or become too uncomfortable, doctors might tweak the dose or switch to a different SSRI. There isn't a one-size-fits-all approach because our bodies and brains are unique, but a patient, methodical approach often yields good results. How can you manage potential side effects? Keep a simple journal of how you feel each day, noting symptoms, mood changes, and sleep patterns. This record helps your doctor spot trends and decide if modifications are needed. If your main concern is sedation, for instance, talk about adjusting the timing of your dose. If you're worried about digestive issues, consider taking your medication with a light snack. Above all, maintain open communication with your healthcare provider. Never feel you're bothering them with small concerns. The physical benefits of minimizing depression through SSRIs can be significant. Seniors often notice an easier time sticking to physiotherapy for chronic pain, improved appetite that helps with nutritional intake, and better focus for managing everyday tasks like cooking or paying bills. Emotionally, alleviating the weight of depression can give you a renewed sense of control. When side effects are managed well, you get the best of both worlds. Relief from depression symptoms without sacrificing day-to-day comfort. If you've been holding back on treatment because you fear side effects, consider this perspective. Side effects are a real possibility, but they're not always as intense or permanent as the rumors suggest. Work with a doctor who values open communication and fine-tuning. By doing so, you help ensure that the potential benefits of SSRIs, improved mood, greater engagement in life, are far more prominent than any short-term discomforts. Before we jump into our final point, take a moment to think about any fears around side effects you might have. Are they based on personal experience, stories from friends, or older information about medications that might not apply today? Clarifying the source of your concerns can help you decide the best next steps for your own situation. Point 4. Integrating lifestyle and social support with medication. One of the biggest misconceptions about using medication for depression is that it's the only thing you need to do. In other words, you pop a pill and magically your mood improves forever. Most healthcare professionals will tell you that while SSRIs can be a game changer, especially for seniors dealing with moderate to severe depression, they work best in conjunction with broader lifestyle and social measures. This holistic approach not only maximizes the benefits, but can also reduce how long or how intensively you need medication. It's easy to fall into the trap of believing medication alone solves everything, or conversely, that you should refuse medication and rely only on natural methods like exercise or dietary changes. The reality is that these strategies often complement each other. A tailored blend of medication, gentle physical activity, meaningful social interactions, and sometimes talk therapy can address the varied facets of depression in a more lasting way. Let's consider Norma, who turned 82 last spring. She was hesitant about trying SSRIs, feeling embarrassed to rely on what she called mood pills. But she also recognized that her long-standing depression was keeping her from enjoying her grandchildren's visits and making it hard to even get out of bed some mornings. Her doctor suggested starting with a low-dose SSRI and simultaneously referred her to a local senior wellness program. There, Norma could attend gentle yoga classes, social lunches, and group discussions about coping with life changes. After a month, Norma noticed that the medication helped her feel more balanced, and the yoga classes improved her flexibility and energy. The social lunches brought new friendships that provided emotional support. When she occasionally felt down, these gatherings reminded her she wasn't alone in facing challenges like bereavement, health issues, and changing family dynamics. Over time, the combination of SSRIs and a supportive environment helped Norma regain her zest for life. Why does this integrated approach matter? Research indicates that social interaction, physical activity, and mental stimulation each play a significant role in regulating mood and cognitive health. Selective serotonin reuptake inhibitors can reduce the intensity of depressive symptoms, creating a window of opportunity to engage in beneficial activities more fully. In turn, positive experiences, improved nutrition, and regular movement can enhance the effects of medication. This creates a virtuous cycle. Feeling better encourages more activity, and more activity further boosts mood. If you're considering or already using SSRIs, think about layering these additional supports into your routine. Could you schedule short walks or a gentle stretching routine each day to help with circulation and joint mobility? Is there a senior center nearby offering activities you enjoy? Maybe arts and crafts, a book club, or a fitness class tailored to older adults? Do you have friends, neighbors, or family members who'd be willing to have regular check-ins or share a meal once a week? Taking these actions has tangible physical benefits, from improved cardiovascular health to better balance and a reduced risk of falls. Emotionally, connecting with others can buffer against loneliness and give you something to look forward to. All of these factors can amplify the mood-lifting effects of SSRIs and help stave off relapses into deeper depression. As we reach the end of our discussion on these four crucial points, debunking the myth of inevitable depression, addressing fears of medication overload, managing side effects, and integrating medication with lifestyle changes, I want to leave you with a question. What small positive change can you make today to support your mood? Whether it's making a call to a healthcare provider, trying a new gentle exercise, or reconnecting with an old friend, your next step can be the beginning of a hopeful new chapter. Sometimes we all need a moment to process. If this information feels overwhelming, take a breath, maybe jot down a few notes, and consider sharing any lingering questions with a doctor or a trusted companion. You're not alone in wanting to protect your independence and well-being, and it's perfectly valid to seek solutions that can help you feel like yourself again. It's a common misconception that once you pass 70, any sign of depression is simply an unavoidable part of aging. The reality is far more hopeful. Treatments like SSRIs, used responsibly, can and do provide a safer path toward emotional balance for many seniors. We've explored how to tackle the myth that depression is inevitable, why careful monitoring can mitigate drug interactions, how to handle potential side effects, and why a comprehensive approach combining medication with healthy activities and social support often yields the best results. You might be thinking, is it really worth trying something new at my age? Here's the good news. It's never too late to pursue a better quality of life. Depression doesn't just dull your mood, it can chip away at your desire to stay active or engaged, which in turn affects everything from your heart health to your cognitive sharpness. Taking steps now to manage depression can help preserve your independence, strengthen your relationships, and even bring back a spark of excitement in daily life. This is not about fear-mongering or quick fixes. Instead, it's about recognizing that depression is treatable at any stage of life, and that SSRIs are one tool among many to help you feel more stable and calm. Of course, always involve your doctor or mental health professional in these decisions. They know how to balance potential benefits with any risks, tailoring the approach to your unique situation. Take advantage of medication reviews, especially if you're on multiple prescriptions, to make sure all parts of your healthcare plan are working in harmony. If you're unsure whether now is the right time to discuss SSRIs, consider how these changes could unfold in your everyday life. Imagine having the energy to do the things you love without being overwhelmed by constant worry or sadness. Picture yourself sleeping better, waking up feeling rested, and having the motivation to take that walk around the block or attend a grandchild's event. Envision reconnecting with friends and family in a way that genuinely brings you joy. If you're ready to take the first step, call or message your healthcare provider. Ask about a medication review or express your concerns about depression. If that feels too large a leap, start smaller. Look up local senior groups or community centers where you can safely share experiences or gain support. Consider a gentle stretching routine at home to boost your endorphins, or even engage in a small creative project to lift your spirits. Each action you take adds momentum toward a healthier, more fulfilling life. Finally, know that you have agency here. You are the best advocate for your own well-being. By staying informed, asking questions, and partnering with trusted professionals, you pave the way for meaningful improvements, both in how you feel day to day and in your broader sense of purpose. Let this be your reminder that it's okay to seek help. Doing so doesn't diminish your resilience. It speaks to your willingness to explore every avenue for living life on your own terms. So here's to a future where the weight of depression no longer dictates your days, and where you feel empowered to embrace each moment with clarity and confidence. Your journey matters, and you deserve solutions that respect your wisdom, your experiences, and your hope for the road ahead.